Hello, I'm Bill Patten, CEO at Holy Cross Medical Center. I want to provide you with an update from our most recent board meeting. This was a regular board meeting that took place on October 27. We started the meeting as we normally do, asking for any conflicts of interest. There was also an education session provided to the board on compliance. We routinely do education sessions to the board on some of its primary responsibilities. Compliance is one that we regularly do updates on. During my report to the board, I gave them an update regarding a number of activities related to our medical staff. Happy to report that we've signed a 3-year extension to our agreement with CCI, Clinical Colleagues International. This is the company that we use for our anesthesia coverage. We have a great team of certified registered nurses, anesthetists, and we're happy to have that contract completed. We also are working to complete a new contract to replace rural radiology. Rural radiology has been our radiologist provider for many years. We've been very happy with their services, but a number of their radiologists are at their point in their careers where they're wanting to retire. So they gave us notice in June that they were canceling the contract, and we've been looking at a variety of options. So we gave the board an update on where that whole project stands. We also updated the board regarding the work that we're doing to update the cardiology practice. As I've mentioned to you, Dr. Jillian Ismail retired, I think, for the 4th time, but we're looking to retool that practice so that we can make sure that cardiology is available locally. We're in conversations with the Loveless Group out of Albuquerque that they would partner with us to provide the cardiologists. We would provide the technical and equipment needs for the practice. Our plan is to have these contract negotiations completed so that the new service could be effective January 1 of 2022. And then just by way of information, we did a recruitment agreement with Dr. Schreiber's practice, Schreiber Family Medicine. We've done agreements like this a number of times in the past. Holy Cross believes it's very important that our independent physicians be able to recruit qualified providers. Dr. Schreiber, unfortunately, had lost a physician assistant, and we were happy to provide a little bit of expense coverage as he recruited another physician to replace that practitioner. On the leadership front, happy to announce that we have filled our plant operations director position. Marty Cortez will be joining us. He'll be starting on the 8th of November, comes to us from the Loveless system in Albuquerque. And then we made an offer to our interim HR director, Tim Egan, to serve as the permanent HR director. He began in that role on the 25th of October. We have entered into negotiations with the Advanced Practice Clinician Unit of the 1199 New Mexico. These are regular negotiations. We don't anticipate having any big issues. But as part of that negotiation, we are wanting to talk about some retention ideas that we have. As we have worked our way through this pandemic, we think it's appropriate for us to say thank you to the employees who have stuck with us. That will be part of the negotiations that we'll have with the 1199. Also on the human resources front, we're looking at new and different ways as it relates to both recruitment and retention. Historically, we've had what I would describe as a fairly short-focused view on recruitment and retention. We have a position open, we advertise for it, we fill it. It's my sense that the labor market has been disrupted in a way that's not going to return to normal based on all of the issues related to COVID. The number of people that want to travel, the number of people that have left the healthcare profession. I don't see the staffing options that are available to us returning to normal anytime soon. So we're now taking a much longer term view as it relates to recruitment and retention issues. We're going to be identifying what we're calling mission critical positions within the organization. We'll be working with the local high school to groom students earlier for healthcare careers, working with the University of New Mexico Taos campus as it relates to healthcare professions. So we have to be much more strategic in our looking at how we recruit. And then, as I've already mentioned, we want to do a good job of retaining our staff, making them aware of how valued they are. And part of that is through recognition. Part of that is through a very competitive compensation program. One of the things that we're looking at is our health insurance. We right now have 2 tiers within our health insurance coverage. We're wanting to add a third one. It would be a high deductible health savings account option that would be available to an employee at no cost. If they wanted to buy up for employee plus one or family coverage, that would cost them money. But with this program, every Holy Cross employee would be able to have health insurance with no out-of-pocket expense. Admittedly, a high deductible, so I view this as catastrophic coverage. But it also would give the employees access to some of the annual exams that are necessary, annual physicals, those sorts of things that would be provided at no cost. That's just one example of one of the things that we're doing to try and think outside of the box, both to recruit and retain our employees. Speaking of the pandemic, and this is, I think, one of the first reports that I've given where I didn't start with COVID. COVID is still an issue for us, but we are seeing a much higher level of what I would call traditional sick patients in the hospital. Just the other day, we were almost full. We only had 2 empty beds in the hospital. 23 out of our 25 beds were taken, but only 3 of those beds were COVID patients. So the number of COVID patients that we've had really has declined. We're seeing a lot of outpatient positives, but the number of patients that are requiring hospitalization, much less ventilator care, has changed a little bit. I believe that the degree to which the community has embraced vaccinations, and then add to that the number of people who actually have had the disease and now have a natural immunity, are contributing to this. But we're not over the hump yet. If you look at some of the recent numbers from the town of Taos, our positivity rate has increased week over week by 100%. It doubled. So we still have work to do in order to get past this pandemic. Holy Cross is participating in the vaccination and testing. We have reopened the annex with the support of the city of Taos. We'll continue to provide that. We also are working to be the hub so that the vaccination product that needs the ultra-low freezer capacity that we have, that we can work with the community clinics, that we can receive the product in bulk and then share it with them on a weekly basis in much smaller increments so that they don't have to spend money on these minus 80, minus 90 degree freezers that Holy Cross has. And just one other comment relating to staffing. In a number of departments, our staffing is quite fragile. The length of time that our employees have been dealing with this pandemic, it's wearing on them. The degree to which they're seeing patients that are critically ill, and actually over the last month or so, the number of patients who have died has been much higher than what we saw a year ago. So our employees are fragile in a variety of ways. Some of our departments, we're just having difficulty recruiting staff. Our respiratory therapy department, our labor and delivery department, the number of staff that are available, even at increased rates, very limited in the country right now. This isn't just a Taos issue, not just a New Mexico issue. It's a national issue. We are competing across the country for these staff members. So I mentioned the short-term and the long-term plans that we have related to recruitment and retention. Part of that is related to the fragility of our staff. We're also talking about options to give them counseling so that if they just need someone to talk to, and that includes our medical staff. One of the things that we recently did to help with employee morale, we had an Oktoberfest celebration. We tried to do it safely. We did it outside on our patio, but we grilled some burgers, chicken, hot dogs, and we provided nice 85th anniversary pins to all our employees. As we celebrate the 85th anniversary of Holy Cross Medical Center, we thought it would be nice to give them something that they could remember. And so every employee was given a pin that our marketing department designed for us. And since we haven't begun doing videos with our interim CFO, Connie Pruitt, I'll just give you a quick summary. Our finances for the month of September, we had a very good month. We had a bottom line a little bit over $500,000. Part of that is recognition of some of the COVID relief monies, but part of it is a reflection on both the volumes that we've been seeing as well as the acuity that we've been seeing. So it's nice to have a strong financial month, especially when we continue to have increased costs related to traveling staff. We continue to stay on top of any additional federal funds that might be available. There is what's called Phase 4 money that we have done the application for. We still don't know exactly what that allocation is going to look like, how much we might receive, but we're keeping track of all of our expenses related to COVID so that once those program details are announced, we'll be able to take full advantage of them. The board approved a purchase of new hardware for our EMR, our electronic medical record. That hardware was about 6 years old, and as you know, in the IT world, equipment in the 3 to 5 year range is thought to be end of life. So this will be an important upgrade so that the speed of the system can be improved. And finally, we're preparing a better capital budgeting system for our board. There are a number of large ticket items. An example would be we need to replace our nurse call system. We estimate that to be $350,000. It looks like we're going to need to do work on our roof. That could easily approach $500,000. So we want to do more than just have a list that we present to the board. What we're going to try and do is to have a schedule of when we expect each of these projects to need to be taken on and how we're going to be able to come up with the money for that. As you know, the mill levy, about $1.3 million a year, we use for capital equipment. We're also able to use a little bit of the COVID money that we've received for projects of that type. Thank you for taking the time to watch this update. As always, give me a call if I can answer any questions for you. Thank you.